Good day, everyone. Thank you for joining our webinar on the Public Health Master's Program at Imperial College. It's great to see your interest in the course. So I'm Azim Majid. I'm Professor of Primary Care and Public Health and also a course chairman, and have some colleagues with me who perhaps can introduce themselves.
Hi, everyone. I'm Zainab Mullah, and I'm the course organizer for the Master of Public Health.
Thank you.
And I think Kenneth, one of the co-directors, will join us soon.
We'll join us shortly. Should we go to the next slide?
Yeah. So, yeah.
So this is our agenda today. So as I mentioned, I'm Azim Majid, Professor of Primary Care and Public Health and also MPH Course Chairman. So I'll welcome everyone and give introductions to the course. And then Dr. Daisy will update on the course content and other opportunities. And then Dr. Zamila will give some further updates about the course. And then at the end, we'll have some Q&A, questions and answers from the entire team. So let's go on to the next slide. This is our some of our course team, not all of them. So I'm the course chair. And then we have Anthony Laverty, who's the senior lecturer in public health and co-director, Dr. Daisy, who's a senior teaching fellow and also a co-director of the course, and Dr. Zainab Mullah, who's the course organizer and teaching fellow, and they're backed up by various other people, such as Joe Tice and others who can't see. We can see them now. So some of the other people on the course. So we have Dr. Miss Solomon, teaching fellow, Miss Jennifer Husbands, who's our tutor, and so deals with personal issues that students might be having, and Joe Tite, who's the program coordinator, and Sylvia Yee, who's the postgraduate administrator. So thank you for all their work on the course. So why Imperial College? So Imperial College is one of the world's leading universities. We're always ranked near the top in any league tables, particularly in medicine and public health, whether it's a UK league table or a global league table. And in the most recent Research Excellence Framework, which examines the quality of research in UK universities, which was published earlier this year, Imperial College was the highest ranked university in the UK for the quality and impact of its public health research. So it's a sign that that we're leading in our research as well as our teaching. So a great place to study if you want to learn more about public health. On to the next slide. So as I mentioned, every period of time, we do assess UK universities in terms of their research outputs, and we did very well this year, as I mentioned, coming top in public health. We're also ranked very highly by other league tables, so various newspapers like the Times and Sunday Times have ranked us very highly in terms of student experience and also in terms of job opportunities. And also our research last year was awarded a Queen's Anniversary Prize, which is a one-off award for our work on COVID-19. So we had a lot of work on COVID-19 in the college over the past 2.5 years in areas like modelling, epidemiology, impact of the pandemic on health services, on health outcomes, on vaccine uptake. So that work was really world leading, as shown by the award of the Queen's Anniversary Prize last year. Next slide. These are some of our examples of some of our research. So a lot of it's been about COVID-19, but we've got other work as well. So we worked on areas like home testing of COVID-19, publishing a very large study about how well that works. We've done research on areas like e-learning, on the impact of the pandemic globally in terms of our modelling work, the impact of smoking bans in countries like Brazil, work on areas like air quality, air pollution, armed conflict, the risks of poor diets and adverse health outcomes, work on minority groups, and work on areas like heart disease and diabetes and genetics. So a very diverse range of work encompassing really everything from genes through to populations, illustrating how broad our research is and its impact globally. Next slide, please, Anna. So why come to our course? Well, as I mentioned, it's taught at a world university, which is really excellent in terms of its research quality and impact. It's taught in collaboration with our business skills, so we do teach some additional skills that you might not get taught on other public health courses elsewhere. It is a full-time one-year course, based currently at the one of our hospital campuses in Paddington, London, but we're teaching also other sites as well across London. And we aim the course at people with a background in health, biomedical science, healthcare management, and social science. So quite a wide range of people enter our course, not just health professionals, but other people as well working in health-related areas. Next slide. So that's our one-year full-time course, but we also offer another course as well, an online Global Master Public Health course. This is a more flexible course in that it's part-time over 2 years and is taught online. So it's easy to do if you're working during the week or if you're living overseas. This is a more flexible option for you. So with a range of modules, and we have a series of steps, which include a certificate in public health, a diploma, and then finally a master's if you complete the entire course and all the assessments that go with it. So if our online face-to-face course is not for you, do think about if our face-to-face course isn't for you, do think about our online course as well, which is part-time over 2 years and an extra option also for public health training. Next slide, please. So as you mentioned, the course is different from our face-to-face course. It's fully online, delivered by Coursera, which is a well-known e-learning company. It's part-time over 2 or 3 years, so you can do it at your own pace, and you can work while doing the course. And as well as having the option of a full public health master's, you can also do either a diploma or a certificate if you haven't got time to do the entire course. So there are various options. So it's a great opportunity, I think, people who want to learn more about public health, but perhaps haven't got time to do a full-time course or aren't able to live in the UK. And there are more details online of that course. Next slide. So our face-to-face course, although it is face-to-face, does offer blended learning. So there's some online delivery as well as the face-to-face sessions. And we have got a lot of experience now in delivering the course. It's been around for around 15 years. So we have great experience. The first two terms are largely taught, and then in term 3, you'll complete a research project with a supervision from one of our academic staff or research staff. Thanks. Next slide. So at this point, I'll hand over to Henok Daisy, who will speak about the course objectives.
Great, thank you very much, Azim, and welcome everyone to this webinar. I'm Henok Tadessa. I'm a senior teaching fellow and one of the co-directors of the Master of Public Health course. So to start with the objectives of the course, as you know, public health is quite multidisciplinary, covers quite a broad range of subjects. So we try to cover as much as possible within the 1-year course. You will see very shortly with the options that we provide students in terms of pathways in the second term. But really, we want to have our students get good grounding in the basic fundamental sciences that define public health: epidemiology, statistics, research methods, and public health. Next slide, please, Zainab. Thank you. So really the first term is made up of intensive compulsory taught modules around epidemiology, biostatistics, and public health. The second term is where we offer students choices between different pathways. We'll see that shortly, but also something that I feel distinguishes our course is this real emphasis on the research analytical end of public health. So we offer through the third term a solid 4 months dedicated for the summer project or the dissertation. Next slide, please. So this is what your first term is going to look like. We've received some questions over email around what a typical teaching day looks like. Essentially, what we have here at the School of Public Health is 1 day dedicated for each module. And as Azim has been saying, we've adopted this blended learning approach where we've developed these very high-spec materials for online learning, which form the basis for our excellent global Master of Public Health degree, but we use those as well in our on-campus course. So what that means is students don't just come for the traditional lectures into class, but we've developed these lecture videos, ETVTs. These are exercises that you can complete on your own time. And once students have exposed themselves with to these materials we put together, you come into class for more interactive discussion-based teaching sessions. So that's pedagogically proven to be very effective. So you'd come so there's time allocated for going through the range of materials we make available ahead of the sessions on Coursera, and you would come into class for the interactive case-based teaching sessions, and further practical exercises also happen over the course of the day. So one day dedicated, it's a term is made up of 10 weeks. So each day, for instance, Mondays is a day for introduction to statistics. Tuesday is a day for principles and methods of epidemiology. Wednesdays mornings are dedicated for additional seminars and tutorials, but afternoons we leave open for our students to engage in the range of extracurricular activities across the college. Wednesdays is a full day dedicated to research methods, and Fridays it's foundations of public health practice. So these are compulsory. Everyone who comes on the course has to undertake these courses. So as you can see, these are the fundamental basic sciences in public health, the methodology related ones, the first three, and then the foundations of public health practice, what are the principles and key approaches in public health. So this would be compulsory for everyone coming on the course, and then we'd go to term 2. So this busy looking timetable denotes term 2, but each student is going to undertake 6 modules all in all. The only compulsory module in the second term is health economics, which you would undertake if you come on the course at the business school. So we collaborate with the business school at Imperial, who deliver 2 of our core modules, health economics, which is core to all the students who undertake the course. So, but other than health economics, everything else is optional over the second term. So this would mean you'd need to decide. You might have seen that there are only 2 streams on the web pages that needs to be updated. That will be updated in the next few days. Hopefully over the next 2 weeks, we'll update all our web pages to be consistent with this information. So we've expanded our offerings of streams. We're actually undertaking that as we speak with the current cohort. We've got one of our biggest cohorts right now, who are on their 8th week of teaching already. So they are going to have all these options of streams. We've developed these streams from our review of our course, review of student feedback, and review and looking at the public health field as it evolves every day nowadays. So we've got streams named health promotion and service improvement, global health stream, environmental health stream, quantitative methods stream, health policy and system stream, and infectious disease stream. So essentially you can combine modules. If you choose 2 modules that qualify to a stream, you'll be able to go away with a Master of Public Health degree that's also denoted by your stream choice. But then beyond that, you still have the option to select a further 3 modules. So you can choose and combine, or if you choose, you could also simply not choose any stream and go away with public health, Master of Public Health, simply the general designation of the degree. So we've got quite a selection over there, as you can see on the screen. Next slide, please. So as I said, a major dedicated timeline of 4 months completely dedicated to the dissertation or the summer project. We generate over 100 projects every year, over 100 projects, and shared with our students to choose from the list. These are generated from some of the cutting edge research that's undertaken across the school. We ask our academic colleagues to contribute project ideas, and you'd have a chance to work with our researchers on your dissertation. So that's closely supervised. We assign 2 supervisors per project, but we also encourage our students and give the option for you to generate your own project ideas, and we'll be supporting you to develop this into viable projects. And a number of these happen every year. I'm a co-lead for the research methods module, through which we work through students' ideas. Some of the assessments are related to defining research questions, formulating literature review, and designing research projects. So if students choose to do so, you could pursue those ideas as your summer project. So we have a range of course assessments. So each module has more than one assessment. Some are assessed through exams, but most would be assessed through more applied practical skills, such as developing different communication strategies, developing video blogs, writing different academic essays, working through simulations, reflective statements, and so forth. But for each assessment, we also offer students the opportunity to engage with a range of formative exercises. You'd be working through different types of assessments, including individual and group work assessments as well. And I have to say, our course is one of the very few courses in the UK itself that offers the opportunity for students to present their final dissertations through a presentation and defend the work through a viva. So it's a combination of a range of assessment skills which are considered to be quite authentic, preparing our students for real-life public health research or professional work engagements. Next slide, please. So our students are quite well supported as well. We assign personal tutors who will provide welfare support and follow-up. It's going to be a very intensive year. We require 100% attendance in our classes. So we are hands-on with following up on how students experience the new life, settling in London, and settling in with the new requirements of a new course and a master's degree. Next slide, please. So a range of extracurricular engagements as well. We run a number of seminar series. We encourage our students to present in these seminars. And we have so many departmental seminars that happen on a regular basis, and we are increasingly giving our students access to these seminars. So you'll be able to enjoy talks and be part of seminars that are run by Imperial academics, but also invited external speakers. Next slide, Zainab. So you might have seen this from our web pages. So we also run annual visits to agencies in Geneva, global health institutions such as the WHO, Gavi, the Global Fund, and so forth. And this is coordinated by the WHO Collaborating Center. So over the last 3 years, because of COVID, we haven't been able to run this in person, but we've run very successful virtual visits where we've had very senior people. This is Professor David Navarro, special advisor to the director, to the executive director of the WHO, speaking to our students. Alongside that, we also have careers advice from the WHO team, offering the range of internship placements and job opportunities to our students. So that's well attended. So we hope to run this in person this year and going forward. Of course, not all students, when it's in person, will not have the opportunity to go. We have a selection method in place. We can only organize this visit in person for up to 35 or 40 students, but all students will have opportunity to be part of some of the virtual activities that will be organized. Next slide. I think this is over to you, Zaina.
Yes, hi everyone. Yeah, so as Henek's already mentioned, you start preparing for the summer research project in term 1, really on the research methods module, where you get a lot of experience in how to do a literature review and how to develop a research question. And increasingly, more and more students are taking their research question forward and developing it into their own research project in the summer, which is great because it's a topic that they're really interested in, really passionate about, and they've also gone ahead to make links with academics within the school. And so the selection process, as Henek said, there are hundreds of projects released, and we have 2 rounds of selection. So in the first round, we release the titles. You pick a choice of your top 3, and we'll submit your names to the academics. They will then contact you and ask you why you're interested in the project, to either submit a brief paragraph or your CV, and then they'll either have a chat with you or look over your CV and then select. And once they've let you know whether you've got the project or not, then you can proceed with the second round of selection, where you either might pick one, get selected for one of your other 2 choices, or you can pick some from the second round. So there's never a case where somebody's not happy or satisfied with their project, because there's such a huge range of projects, and I'll come to some examples in a minute. Usually students are very happy with the project that they get. So in April, sometimes you might need to do an ethics application with the study team. So there might be some pre-activities in April, but mostly the project starts at the start of May. And then after you've been working on the project for about a month, we have a check-in presentation where you're going to show us your research question, your aims and objectives, and your plan for the next few months. And this is 10% of the total mark. And then June, July, August really focused on data analysis, data collection, and in August really focused on the write-up, which is 9,000 to 11,000 words. And then after you've submitted, 2 weeks after that, you have a viva, as Henek said, a presentation with 2 academics that have not supervised you. And that is also 10% of your mark. So throughout this whole process, you're really supported well. So it is a challenging project because you're doing real life research within a real life research group. But as Henek said, most projects have a minimum of 2 supervisors. Sometimes you have more, and you really get hands-on expert supervision. So you have regular meetings with your supervisor, but in addition, the course team provide summer support sessions. So if you're doing a systematic review, for example, there'll be methodology sessions on systematic review that you can attend. There'll be statistics and support sessions. There'll be revision sessions on how to write a literature review. And then towards the end, sessions on how to present your results or how to write up your thesis. So a really challenging and intensive research project time, but really well supported as well. And most students really enjoy the research project, and we get excellent feedback always on the supervision in particular that the students receive. So here are some examples of past projects. I know there were already a few queries and requests for this. So there's a huge range of study designs and a huge range of topics covered, and this is really a very small snapshot of the projects that will be available. So here are some examples of the topics covered within systematic review. So at the top, you can see there's one on virtual food environment and how this impacts dietary intake and obesity. And then there was another systematic review exploring frameworks and models that can upscale health innovations and improvements. And then we always have a lot of projects on tobacco control and tobacco control policies. We also have a great environmental epidemiology group, so they always have lots of projects on air pollution and related topics. And COVID-19, as you imagine, for the last few years, there's been a lot of projects on this. And then there are not as many primary data collection studies, but there are a few each year. And so these are two examples, one looking at physical activity, social interaction and community space. So that was interviewing participants. And then the one on dietary and lifestyle habits was a survey that was carried out for UK students. And then there are a lot of studies, a lot of projects looking at cohort and trial data. So these are just some examples of different data that students have looked at. So looking at survey data from the European Union and looking at the burden of current and past smoking in this data, modeling the COVID-19 spread, looking at visa transaction data, looking at trial data to look at nutrition and cognitive decline. And then here you've got a project on the association between urban green sprays and respiratory disease in the UK Biobank, which is one of the biggest UK cohorts. And then other projects on diabetes and looking at how welfare benefits affect physical outcomes in children who experience poverty. So you can see a really huge range of topics and study designs. And as I say, this is really a very small snapshot of all the projects that will be offered. And then many students develop these projects into publications. So it does take some time after you finish the project to do it, but here's an example of here's some examples of a few that have been published. So this one, looking at access to primary care and visits to emergency departments in England, published in PLOS ONE, and Professor Azimajid is also an author on this one. And then this one looking at systematic review and meta-analysis of cohort study looking at blood pressure, hypertension, and the risk of sudden cardiac death. And this one was in the European Journal of Epidemiology. And this then a Cochrane publication looking at community-based interventions for improving mental health in refugee children and adolescents in high-income countries. And we had quite a few similar and related projects to this, I think, this last year. And this looking at effects of exposure to tobacco and electronic cigarette use, published in the Journal of Adolescent Health. And this one is from Philippos Philippidis, who is our Director of Education. And then we've got a qualitative study here from Henok and some students that he supervised. So looking at male involvement in reproductive, maternal, newborn and child health. And that was in reproductive health. So hopefully that gives you a good idea of the range of types of projects that we offer, and also that some of the publications resulting from the projects. So moving on now to careers and where the students go on to. So as Henok has said, we really give students an authentic experience through the assessments, through the activities that they do during the course, so that they're well prepared for any role within public health that they go on to. And there's a wide variety of roles that our students go on to. So 5% go on to become lecturers, then another 5% that might be research advisors. Quite a lot of students go on to analytic roles, so working as an analyst for various companies, and then management and consultancies. Quite a lot of our students are medical doctors, so they go on to be public health registrars. And then you've also got research fellows, and a lot of medical students will go back to being a physician. And this just shows the range of employers here. So the Department of Health, you've got policy and think tank organization, health protection and promotion agency, you've got startups, consultancy firms, And then higher education, a lot of people go on to work in higher education, and then also the NHS. So a really wide range of roles. And if you look on LinkedIn, you'd readily be able to see that our students are working at such a wide variety of employers in a wide variety of roles. So in the UK as well, we have a lot of our students go on to work in local authorities as well. Yeah, so we offer quite a bit of career support throughout the year as well, and we have a really excellent career service at Imperial. They offer many sessions throughout the year. There are courses that you can do. You can have one-to-one sessions to develop your CV or to have someone go over your applications. And then we also invite alumni of the course. We invite various professionals to come and speak to you as well throughout the year. So there's a lot of career support throughout the year. We have a PhD information session as well in term 1. So there's a lot of support for you to get an idea of what you might go on to next throughout the year. And this is from the career service. Again, I'm just advertising some of their services, and you can go and look this up online and see what they have. They have these attributes and aspiration courses, which are really good to do alongside the course and really give you a lot of transferable skills. So to finish then, some books on public health that you might like to read. It's very much in the media now due to COVID, and many of these books are available. And the website, as Henrik said, will be updated soon to have the extra stream information, but feel free to message us. And I think I'll hand back to Henrik now, and we'll deal with queries.
Great. Thank you very much, Zainab. I hope Azim is with us still. So we can...
yeah, I'm still here. Thank you. Yeah, thank
Great.
you.
Thank you, Azim. So we can look through some of the questions. Now, seeing some questions, I know Joe and Tim are responding live, but one question that I think came through was around the choice of streams, if students could choose more than one stream. The whole idea of a stream is to enable students to kind of concentrate their effort given their career objectives. So we kind of limit it to one stream choice. And this is an evolving design that we are trialing through our course, but you can only choose one stream. But that doesn't limit you from choosing other modules from other streams or non-stream designated modules. So it's a quite choice-oriented design that we have, but also we emphasize the quantitative method end of things, the epidemiology and statistics, but that is not to mean that we don't cover qualitative research and mixed methods research. We do that quite well. So within the research methods module, all the three research traditions and approaches and the specific methods within those are covered well, but also there are other specific modules that are contributing to this objective. Students go on to do qualitative research for their dissertations, some mixed methods research, modeling studies, infectious disease modeling, quite secondary data analysis using quantitative methods, and some going out, such as one of the studies that Zainab showcased, which I fortunately happened to supervise, where a student went out to Uganda, collected primary data, and wrote her dissertation. So there's quite a lot of choice, and we're here to facilitate students' interests along the way. Any other question that we need to respond to, Joe, if you could highlight some?
The one about blended learning, how much of the course is blended learning?
Great, thank you, Joe. Blended learning, so it's the design as a whole is blended learning, right? So students are encouraged to cover quite a bit of material before coming to class. The class discussions are more advanced than the basic lectures and learning exercises that are shared online. But that's not to mean but there is a significant interactive element through the course of the day that students would have with the respective lecturers and module leaders. Say, for instance, if I share the research methods module, so students would come to class between 11 or 10 a.m. up to 1 p.m., allowing 3 hours of interactive group work-based exercises that aim to advance, what's been addressed online. But it's a new approach where it's called a flipped classroom approach, where students have the initial effort on their own and come to class with actual questions. We've been doing journal clubs throughout the module, for instance, where we've asked students to read through set articles and come to class for further discussions. And then there's an office hour in the afternoon. With epidemiology, for instance, students coming to class already having worked through epidemiological set exercises and going through some tutorials in the morning, and then they go into lectures in the afternoon, and then further practical exercises afterwards. So it's structured in such a way and varies slightly from module to module, but the general idea is that we build on students' initial efforts. I think it's worth addressing some of the questions around the opportunities for students to work with the range of expertise at the School of Public Health. There was a question on infectious disease modeling. We have one of the leading centers for infectious disease epidemiology, the Department for Infectious Disease Epidemiology at Imperial. So we'll have quite a lot of opportunities there. They offer a lot of projects for us every year, and we'd be working with some of the leading researchers there. Maybe, Azim, we could invite you to say more about the Primary Care and Public Health Department.
Yeah, so as Henrik mentioned, we have a wide range of projects, everything from genes to populations. Within my own department, we have opportunities to work, for example, with the health service on evaluation of healthcare programs, public health programs, programs to improve quality of care. We also have the opportunity to work with large data sets derived from the NHS, so work on clinical epidemiology, for example, health outcomes. And also we're working out more and more nationally with bodies like the UKHSA and NHS England. And so for next year, we'll have work, for example, around vaccination up in England for COVID, looking at things like variations amongst different ethnic groups and variations in outcomes of vaccination, depending on number of doses you've had or your clinical characteristics. So lots of opportunities to work with us on a wide range of projects, depending on your future career path.
Thank you, Azim. There's one question about, the difference between the online and on-campus courses. It's essentially the same team delivering the online course. It's the difference is it's tailored to part-time engagement. There are people who would want to continue working on their jobs and engage. Otherwise, I teach on the online research portfolio. For instance, I and quite a fantastic team have developed these online resources, and we have these continuous live sessions with our online students from across the world. The same goes for all the other modules. They are well supported, designed, and delivered by the very team that delivered the MPH. There was another question around whether the PG Cert, PG Diploma do not apply for the MPH as an entry qualification. So you can't come on the Master of Public Health on-campus course aiming to go away with a PG Cert or a PG Diploma. You can't enroll for those. There is not that option on our course. You could do that on the online course, but not with the on-campus course. But if something happens on the course of the MPH course and you can't quite complete the full course, and this doesn't happen often or happens very, very rarely, we do offer our students to go away with an exit award, such as a PG Cert and PG Diploma, but you can't enroll with that in mind at the outset. Do international students end up working in the UK? Quite, that's supported through different through different opportunities. To begin with, there's a post-study work visa that the UK government runs. So if you're an international student, then that works not just for our course, but across the board. I was an international student who came into the UK, completed my PhD, stayed on, and I'm working with this course now for the last 8 years. But the post-study work visa enables international students to get a work permit immediately after their postgraduate study. A number of our students stay on to work in the different career pathways that Zainab outlined earlier. So yeah, happens many times.
There's a question about work experience in public health for the course. Our students actually come from a very wide range of backgrounds. So that is not required for the course, although it's helpful, it's not essential. Some people come from university at 21, 22 without having worked. Others might have worked in the health service or public health for many years. So yeah, so it's helpful, but it's not essential to have worked in public health. What we want is really, commitment from you rather than prior experience. So as I mentioned, our students are very diverse, some quite young, some much older. So the experience in public health does vary quite a bit.
Yes, and one about social science backgrounds and coming on the MPH. Quite a number of our students come with social sciences backgrounds, management backgrounds, humanities as well. What we will make sure, and as you highlighted, the person who's asked the question, we try to see if there's been public health exposures, experiences, and we try to ascertain the readiness to undertake the quantitative subjects that we offer, like epidemiology and statistics. So even if you haven't covered that through your undergraduate degree, you can demonstrate your capacity by undertaking tailored online courses and completing successfully, or other ways where you've worked on a project and have had experiences with those subject matters. So applications are looked at in totality, not just in one through one aspect. Perhaps also very important to highlight that our course does not have an explicit deadline for applications, but it tends to fill up very early. Especially since the last few years, we've been seeing this trend. We've had to close the course very early last year. I don't know, was it in March? If my memory serves me right, we had a very long waiting list at the end, and we couldn't accommodate all students who had qualified otherwise, but hadn't submitted their applications on time. So please, if you're intending to apply, do get your applications early. We're already getting a lot of applications, and we endeavor to kind of complete all our reviews and get our class in order as soon as possible. So perhaps also worthwhile highlighting the scholarships that we have on offer. So we have the School of Public Health scholarships, which cover the tuition fees, the home student tuition fees. So other applicants would need to make up for the difference. We have the Dean Scholarship that we get from the faculty, which covers about £10,000, contributes £10,000 to students. With the School of Public Health Scholarship, we look at students, it's looked at from a merit perspective, where we look at students' academic excellence and experiences and readiness. It's very competitive, but at the same time, we look at the need highlighted in the statement of purpose you'd be submitting as part of the scholarship application. So please look at, there's very clear, detailed instructions on our web pages. But our students come with a range of other scholarships covering their costs to come and join us, the Chevening Scholarship across the world, the Commonwealth Scholarship, the Shared Commonwealth Scholarships, and other schemes. So please look out for other scholarship opportunities that can enable you to come and join us on our course. There's a question about how we work with local CCGs and NHS trusts, GP fellowships through Imperial College Masters Program. Azim, if you would like to cover that.
So what was the question again? Sorry, Henok.
The local commissioning groups and NHS trusts and GP fellowship.
About projects with them, you mean about projects with them?
Yes, we've got collaborations and active.
Yes. So we work very closely with our health service partners, both on the provider side, so with primary care teams, community teams, mental health teams, hospital teams, and also with the management side, the commissioning side in NHS England and integrated care system. So in the past, we've offered projects in all those settings, so some with primary care, some with hospital teams, and some with the NHS commissioners and managers. So, for example, recently one of our students published a paper around the use of what are called MDT meetings. So these are teams involving health professionals from different backgrounds and their impact on health outcomes. So we do work with a range of NHS partners, both on the provider side, in hospitals and the community, and also on the management side in the commissioning bodies.
Thank you, Azim. One question about whether students are allowed to do part-time work. Yes, it's your statutory right, but given the intensive nature of our work, we always advise our students to limit the part-time work engagement over the course of that first the one intensive year that we have. But yes, some of our students do engage in part-time work. And there's a question about the applicability of the English language requirement if one is a native speaker. Please look at the provisions on the web pages for Imperial College and the course-specific pages. It's clearly laid out there. If you're a native student, if you're a native speaker, you're not required to undertake the test. But also there are other exemptions for named countries where English is the language of instruction and you don't have to undertake those tests necessarily.
The question about company affiliations. So the college is not really linked with any commercial company. So our course is independent of any commercial company.
Okay. So there's a question about personal tutors. Personal tutors, the main objective is welfare support. There's a range of welfare and student welfare. So we want you to have a good work-life balance. We want to support your welfare. We know it can be a very intensive program over the year. So the main engagement is making sure that students are progressing, are thriving on the course. So our personal tutors would meet with students 2 to 3 times a term, have deep conversations about their career objectives, advising across the course of the year. But that's not the only avenue for support and interaction with our faculty. We've got the module leaders and of course the lecturers. The course team, Zainab, is our fantastic course organizer, very accessible and supportive to our students. And Anthony Laverty and myself are the co-directors, also are very, very accessible with our students and work very closely. So it's a very collegial, supportive environment that we try and create and interact with our students very closely, but also students are represented through student representatives who sit in a number of the key committees of academic governance and reflect student needs across the year.
There's a question about can the course be done overseas, or at least part of the course. The course is based in Imperial College full-time for a year, so that the answer to that question is no.
Any other question that we need to get to before we wrap up, Joe?
There's no more that have come through. If anyone's got any more questions, please put them in the Q&A.
So regarding the optional module choice, that's also a well-supported process. So actually our module teams present their module content and how they run the module, how that helps students' trajectories before students finalize their choices. So you'll be able to have access to the module specs, the module handbooks, but also presentations, and have an opportunity to ask questions of the module teams before deciding your module options and your stream options. Yes, so from early December, our updated stream choices, the course structure, including the current handbook with which we're working, will be made available on our web pages. When you join the course, we will have 1 week fully dedicated for induction. So we just don't immerse our students directly into the teaching learning process, but we have 1 week where we get to know each other. We unpack all the expectations for the academic year. One more thing to highlight is one about the formative essay we ask you to complete as you come on our course. That is to, so that doesn't count to the summative assessments, but you get the opportunity to get detailed feedback from our faculty, and that sets the expectations regarding academic writing and gives you an early feedback so that you can work on your writing and submissions across the board.
I think just on that point from Henok, the writing skills are very important because you are judged on what you write ultimately. So it doesn't matter how hard you studied, you know, what you know, in the end it's what you write in your essays, your dissertation. So it's very important to work on your writing skills. And there are ways of doing that. You know, for example, we encourage people to respond to letters in journals. For example, it improves your critical thinking. To respond to articles in journals improves your critical thinking, for example, your peer review skills and your writing skills. So yeah, so do think about the writing skills. There's also a question about people who struggle on the course. So most of our students do well, but unfortunately some people will struggle. So if you are struggling for whatever reason, whether it's personal reasons, health reasons, it's very important you get in touch with us early on so we can support you in that. So we're aware students will have some problems, whether it's a mental health problem or a physical health problem or some personal issue. So if that is the case with you and you are on the course, do get in touch with one of the course team early on so we can help you get through that. For example, arrange perhaps more time for your assessments, for example, or extension to your dissertation. So we'll do what we can to help people who are struggling for whatever reasons, but it's very important to get in touch early on if that is the case.
And then to support you, and then in your readiness to undertake the course, we do send a pack of resources beforehand that you can read on and get ready for epidemiology, statistics, and the other courses. We don't actually assume prior knowledge. We teach things from a very basic level up to the advanced levels that we cover. But if students are, and the number of students are motivated to do that, around 2 months prior, we send out a pack of resources that students can do before coming on the course. There was one question about the names of the books that we've shared. I believe the slides will be shared with you. That is to pique your interests. We've randomly selected these very key public health books that are quite accessible, like the Spirit Level, showing you how epidemiology can be used to map out health inequalities and argue persuasively for better health conditions at the population level. Yeah, so we've simply selected some 4 random books that you can read.
There's a question about whether students can work together. So that is something we would encourage to discuss issues with your students, so discuss course material, questions, etc., course content, because interaction with your colleagues does improve your level of knowledge and also your understanding of key public health facts. So do work together with your colleagues, although your exams and assessments are done on your own performance rather than that of a group.
And just finally, I think good to highlight that our alumni are quite engaged across the year. We invite them several times over the years to come and speak to you as you choose your module options, for instance, presenting their dissertations. And so you'll have, but also around, once you've completed your enrollment, some also make themselves available to advise you on things and tips and that could help you to successfully enroll and then complete the course.
There's a question about what students can do before they start the course to help them with the course.
So the books that we provided, but also we will share a pack of resources a couple of months or even earlier with students to help them to acquaint themselves. But our courses are very thorough, starting from the basic principles and concepts all the way to the advanced levels. There is time factored in for your independent study times. So we will provide those things, but the courses don't necessarily assume prior knowledge of the subject matters covered during the modules. We're coming to the final minute, just to stress and emphasize again the need to submit your applications as early as possible. Don't leave it too late. It's a trend we've seen over the last few years. Places are filling up quite quickly, even though it's a rolling application. We had over a large waiting list last year. Any last words, Azim, before we close?
No, thanks. Thank you everyone for joining, both from the college side and also from around the world, our audience as well. So thanks for the excellent questions that you've posed for us today.